Welcome back and thank you for staying with us. Now, nurses and doctors in Africa are leaving the continent to join health services in the UK and other countries. Thousands of health professionals have left Zimbabwe and Nigeria in the past 2 years. According to Nigeria's nursing union, 11,000 of their members have moved abroad since the start of the COVID-19 pandemic. Now, the main reasons for their departure are better pay and working conditions, obviously. So what's the situation like in South Africa, which also has highly skilled nurses? Are our medical professionals leaving our shores? We're joined by Democratic Nursing Unions of South Africa General Secretary Kwena Manamela. Mr. Manamela, thank you very much for your time here on eNCA. This is obviously not a new phenomenon. It's something that's been happening in South Africa for a number of years now. And I imagine because of the fact that the nurses haven't won their fight against government when it comes to wage negotiations, more and more are leaving the country.
Yeah, good afternoon to you and the viewers. Indeed, it's not a new matter. One of the health professionals, especially the nurses leaving the country. Remember, prior the OSD being signed as an agreement in 2007, if I'm not mistaken, there was a brain drain. A lot of professionals were leaving South Africa. The nurses were leaving South Africa to, as you said, to the UK, to the Arab Emirates and other countries. But after the OSD, I think the one of the purposes of the OSD was to try and bring as many as possible the nurses that were outside of the country included. Remember, the OSD was not only for the nurses, but it also extended to other health professionals, your doctors and so on. But the nurses were the first it was piloted on the nurses actually. So prior the OSD, several of the nurses came back to the country I think it brought around 12,000 nurses back to the country. But I think the OSD didn't do what it was supposed to do. Yes, it brought them back. They thought maybe coming back to the country, they'll be better off, but that was not the case because the one for the nurses, I think it was not properly done. As we are now, we're still dealing with a lot of issues around the OSD of the nurses. Now, it's a reverse now. Professionals, health professionals, the nurses, they are now leaving the country. We might not have the correct figures as of now, but what we can tell is that there are nurses that are leaving the country to other countries. Again, we thought we're done with the problem has been solved, but I think we're back to square one now because of the poor conditions of service that these health professionals are under. Mostly, I think the COVID-19 has exposed it as well. That there are a lot of nurses that are not working. Some of them that are leaving is because they're leaving because there are no opportunities or there are no vacant positions opened in South Africa. So they are leaving to feed their families because they can't afford to stay at home indefinitely if there's no promise that there will be openings tomorrow. So most of them are given contracts. Remember, there are COVID-19 COVID contracts. But the contracts, because there's no guarantee, there's no stability, you can't renew your contract every 3 months. It's not sustainable. So some of them, instead of continuing to renew the contracts, then if there are opportunities elsewhere or outside of the country, then they will grab that with both hands.
All right. So when it comes to, negotiations, wage negotiations, etc., it's something that government hasn't been able to keep its promises on. And meanwhile, people are studying to become nurses. There are vacancies. There are vacancies in South Africa. We have had that confirmed from the health minister that we need more and more nurses and doctors in our country. But those vacancies are not being made available and budgets are being cut. So what do we expect from these nurses who go to school, finish what they're learning, and then they must stay at home?
Yeah, it is actually ironic. It is very expensive to train one nurse. For the period that the nurses went through that training, especially those that are trained by government themselves, that are supposed to do community service thereafter, it's very expensive to do that. And it's ironic if the department is saying they need nurses, because we have got a lot of nurses that are sitting at home. Our preliminary investigation showed that we've got plus minus 20,000 of the nurses that are at home that are not working. But we have got around 16,000 vacancies that are there that needs to be filled. So the nurses that are at home are actually more than the vacancies that are there. If all those that are sitting at home are not working, they are employed. Actually, they may be able to fill the gaps that are there in the health system, because those that are there, they are really working very hard, very skeletal. There's a severe shortage of nurses elsewhere in the country. It might be this province or that might not having that very big shortage, but
Yeah.
all over South Africa, yeah.
Yeah. All right. Well, thank you
There's a
so
big
much.
shortage of nurses.
Thank you for your time. So, Democratic Nursing Union of South Africa General Secretary Kwena Manamela.